It's Thursday. Our vet is here answering your pet questions. So if you have a problem with your pet, give us a call, 918-460-KJRH. Today we have Dr. Jessica Zink answering your questions, and she's brought little Bandito this morning. I like the name.
Yes. He's a very cute little guy. He's sort of a Dachshund Chihuahua kind of a mix. He's about 13 weeks old, and he came to, I believe, Southern Hills with parvo.
Okay.
Which he survived, and he is ready to be adopted. He's going to be available at Arrow Springs.
Okay. 13 weeks old. Is he going to be big?
He'll probably be a little bigger, but I don't think he'll be too big.
Yeah, since he's got a Chihuahua mix in
Yeah.
him. All right, well, let's get to our calls. We have Carol on the line from Locust Grove. Hi, Carol. What's your question?
Yes, we've got a Rottweiler and a Basset Hound, and they have real bad gas problems. Is there anything that you can do to help prevent that?
Well, you know, it's funny. Some breeds actually do have a tendency to have more issues with that. But for the most part, it really kind of depends on their diet and, you know, what type of diet you have them on a regular basis. But I would try and stick to sort of a higher quality diet if you're able to. You know, some of the bigger name brands can cut down on that substantially. But yeah, I would definitely check with, you know, some of your pet food providers and see what they suggest.
I know when I switch my dog's diet,
It does get
switch
bad.
up the dog food a little bit.
Yeah.
Don't do that.
Do it gradually.
Yeah. Jackie from Tulsa's on the line. Hi, Jackie. What's your question? Do we have Jackie on the line for us? What?
Yes, I have a lab mix, and I'm having trouble getting him to eat his dog food, and I was wanting to know what I could do to get him to adapt more to just the regular dog food.
What kind of a dog food is he on right now?
Right now, we just have him on, like, the kibbles and bits.
Okay.
And we've tried different types of dog foods, but he'll eat a little bit, and then he may go, like, 3 or 4 hours without eating anything.
Okay. Well, and some dogs just tend to be more and less food motivated. So really, you know, just find a really good quality diet and offer it to him probably twice a day if you're able to. What I typically like to recommend is that you put down a certain amount of food for whatever their weight is. Leave it down in the morning, pick it up, and then put it back down in the evening. And what they don't eat, it's okay. They can eat it later on in the day. And then that sort of forms them into a schedule.
They get on a plan.
Right.
All right. We have Rachel next on the line from Tulsa. Hi, Rachel. What's your question?
My dog has diabetes, and I have to give her 2 insulin injections every day. Do you know of any other treatment?
Unfortunately, no. And I sympathize. Diabetes can be a challenging disease to try and treat, but that's probably going to be your best bet to keep them managed.
Okay. All right. Do we have any other calls? Oh, Connie from Oologah. Hi, Connie. What's your question?
I have Rottweiler that's 7.5 years old. He's on his 3rd vial of a regimen for allergies, and I need to know he has severe reaction to these. Can I give him Benadryl or anything to help offset?
Absolutely. Benadryl is typically about 1 milligram to 2 milligrams per pound.
Okay. And if you're interested in adopting little Bandito, where is he available at?
Arrow Springs.
Arrow Springs. Okay. And is he going to be on animalaid.org as well?
Yes, he is.
All right.